As mobile devices like iPhone and iPad proliferate throughout organizations, we're witnessing new types of complexities in these device deployments that we've historically never had to consider. Now, in some of these cases, this is due to just the sheer number of devices that users need to embrace, kind of like Joel, to get their job done, right? In other cases, this is due to the challenges around our wireless network infrastructure, something all of us here can parallel to with our phone yesterday. And in other situations, organizations are deploying mobile devices without really thinking through the unique value that they provide, or the specific workflows that the devices might modernize, which of course is the whole point. How do we drive productivity and efficiency for our users? Now, these are challenges that can affect mobility initiatives in any industry. However, today we'll be examining them through the lens of clinical communication deployments in healthcare. Now, as Jamf has continued to invest in helping healthcare organizations succeed with Apple, we've been thinking through how many of these challenges might be mitigated through integrations and strategic partnerships. So with that, I'd like to invite Tim Needham to the stage, Chief Commercial Officer at PatientSafe Solutions, to tell us about their unique approach that we've been working on together. Tim?
What's up, man? Thank you, Adam.
We appreciate you being here today. So to get started, can you give us a brief snippet of who PatientSafe is and what your mission is?
Yeah, sure. Our mission really is about making the experience of care simple and effective, not only for the caregivers, for the patient, also health system administrators. Talk a little bit about what we do. We're an enterprise app developer. We use iOS devices in hospitals to help care teams become much more efficient at taking care of the patient. I'll ask a question. If I were to ask a question, who in this room knows a drug dealer that uses a pager? Not many people with their hands up. You all should. It's your doctor. Literally the environment working out there. So our job is to bring an app that basically allows voice over Wi-Fi, texting, alerting to an inbox, detailed patient information, being able to see who else is taking care of the patient all in one spot on a mobile device, on an iPhone for the end user. What we find is it's a really compelling story, keeping in mind we're a little behind in healthcare IT. But the devil, it's really the details of the implementation complexity and how do we sustain these fleets right now that we struggle with.
Sure. Thanks for the overview. So can you provide us some comments on what's really driving this trajectory around mobility in healthcare? And then beyond that, what are some of the key challenges that you see health systems face as they look to modernize their approach?
Yeah, sure. We're really fragmented. I'll talk about that in a second with our communication in healthcare. Just to give you guys an idea of what's driving the investment in mobility, we're trying to get nurses and physicians to use a single app to do really 80 to 90% of their communication. We'd be happy with that. And we find that texting, voice, and delivery of critical alerts really makes that body of work. And mobility has the capability of driving that. In terms of the backdrop on the industry, I mentioned the pager thing. We really have a collaborative work environment. If you're in a hospital for 4 days, your average number of people that take care of you is 50. And they have to obviously communicate, collaborate a lot. Downside is today they're using legacy wireless phones, pagers, desk phones. They're yelling at each other down the hallway. So it's really a big mess. And in some cases, you've got groups of clinicians that take care of the same patient that actually use different technologies. So you constantly have to think about, how do I reach that doctor? How do I reach that nurse? And it's a tax, and it creates distractions. And those distractions kill patients. We know that from research. So it's something we have to address. We use shared device models a lot in healthcare, which complicates. We've got folks coming in, signing in, and grabbing an iPhone, logging in, and turning it in at the end of the day. It's not their personal device. Now, all that said, we absolutely have to fix this because our cost of labor in healthcare is over 50% of the operating revenue in the industry. So this is a big deal.
For sure. So it certainly sounds like many of these challenges are things that organizations in any industry could face as they look to implement mobile in their environment. So with the challenges, how is PatientSafe looking to methodically solve this problem in new ways?
No, thanks. We built a framework. We call it Mobile Maturity Model for Healthcare. Really, it's designed to take organizations that normally think very short term and force them to step back and put a strategic mobile vision, in place. We tend to be real short-sighted in healthcare, so this really helps that process.
Sure. So if we zoom in on the model and start to peel it apart, where does it really come together, and what do you see most critical for perhaps this audience?
Yeah, I think we worry a lot in healthcare about outcomes. Why are we doing what we're doing? So really 3 parts I'll focus on. One is current state and really documenting that. Why are we doing it? What has to change? Number 2 is infrastructure. The Achilles heel of mobile in healthcare has really been infrastructure, the cost and complexity and best practices. We deliver voice over Wi-Fi, which has a complexity to it. So we spend a lot of time with our customers managing through that. And then the third piece really is that sustainability piece. Two big things about healthcare. If we screw up on a deployment, our clinicians have a lot of weight. So if we mess up once, it's 10 times harder to do it the next time. Secondarily, we have really understaffed IT departments. So if you think about deploying a mobile fleet across an entire health system, just the management of that will literally drown and overwhelm an IT department. One thing I'll mention there too on that one, we've got a couple partnerships that have evolved in the industry. We rely heavily on the benefit of what Cisco, Jamf, and Apple have done together, really to improve user experience. It's brought a lot of value back to the industry, so I just want to call that out.
Sure, sure. So do most organizations that you work with really see the need for a modern MDM? And even if they have an MDM, are they thinking through the ways that it may integrate with these different layers of the stack?
Yeah, it's good. A lot of them haven't, but we certainly spin their head around quick so that they do. I think if you don't develop a competency in mobile, like I said, you'll in mobile device management, you'll get drowned. So there's 3 areas we see benefit. App delivery for us, we use Jamf Pro, talking too fast, sorry. We deliver our app, no one has to touch the device with all the settings, et cetera. So that not only does that improve user experience, but from an IT staff standpoint, it makes it basically survivable. The infrastructure side, even if we do the infrastructure right, we do have to make sure that the devices, the apps are all marked correctly for network access. We use quality of service for our voice. And I'll just say on the device deployment side, I mean, we do deployments that don't use Jamf, and man, it's different. I mean, it's the tax on us, the tax on the client's bigger. I also manage our customer success and implementation teams, and our hot list of customers that are struggling right now. It's a litany of other MDM vendors, but we don't see Jamf on there. So it's made us unapologetic advocates to our customers of considering Jamf at a minimum for the iOS device fleet management.
We appreciate it, for sure. So after all the key capabilities have been addressed, how does this really come together in a rubric as you assess an organization's mobile maturity?
Yeah, thanks. We built a model, and it's got 5 stages we've identified. Goes everywhere from 0, which is kind of looking the other way and put a Band-Aid on an ad hoc mobile initiative, to organizations that aspire to be at that 4, which is it's really a mobile first. And to be mobile first, that mindset that we saw from SAP, that is not where healthcare has been. We typically find that most CIOs will report back to being stuck on a number 2 in our model. But what the model does at least is it gives the CIO a way to assess their organization, gives them a way to put a name to the strategy. And these are all things that go into really building credibility with the organization.
Awesome. And at the end of the day, it's really all about our users, right? So with what you see in healthcare and the demanding needs of clinical users, are there other vertical markets that you see maybe have parallels to those user needs?
That's a good question. Yeah, it's got to be. I mean, what we know about our user base is they are mobile. They're demanding. They're taking care of patients. They're saving lives. They also need reliable network access. What we have found in healthcare, again, get back to that demanding user, if anything in the system breaks down, then they tend to write off the entire ecosystem, the technology, the network, and just call it unreliable, and we end up with closets full of mobile devices. So I think that while we may be on an extreme, any vertical that has a large number of mobile workers, called field services, retail, hospitality, I'd expect over time more business critical work will be done mobile, so that same demand for consistent experience is going to grow. And I think the framework we built, something like it for every vertical, at a minimum, it's going to reduce risk. It's going to reduce risk to adoption, and certainly give you a better chance of being sustainable.
Sure. Well, Tim, this has been an awesome conversation. We really appreciate you talking to us about up-leveling a mobility strategy. But there's one more thing. We've been working together for quite some time at UC San Diego Health, and wondering if you could maybe give us a brief update of the project there, since it's been a consistent theme at JNUC over the past number of years.
Yeah, it's cool. Add some continuity. So, yeah, UC San Diego Health started several years ago. They deployed iPads to their patients in every patient room in this new Jacobs Tower that's behind us in San Diego. And it really gave a lot of control over the environment to the patients, which is key to making patients feel comfortable at a difficult time. And while that was going on, we were chatting with them about, hey, what about the caregivers? Let's plan to get a fleet of iPhones out for them. And so this last summer, the quick update is we did get that deployed. What was interesting I found about the project, different from most they had the deployment of Jamf in place. They were very comfortable with iOS devices, so really allowed us to divert our focus off of that and focus on their infrastructure upgrades, their workflow redesign, things that we probably wouldn't have focused on as much otherwise. So we went live this summer. End user feedback's great. I'd say the key success areas, voice performance there. We use Fastlane with Apple and Cisco. It's been great. And then the deployment model itself, we dropped 300 devices on all the shared devices on all the users in the course of a day across 2 facilities, and we had 0 operational issues relative to network connectivity or settings in the devices. So when we have a clean go live like that, it's great. Key thing I'd say is now they're repeatable. They've got a vision for over 1,000 iPhones across their users, so they literally have that deployment model. They pick it up and they plug in the next one. So it's kind of a neat project, and we love it because it's in our backyard. It's right across the street.
And it's, of course, near and dear to our heart, too.
Absolutely.
And so it's so cool to see this investment in the entire Apple ecosystem come to life, whether it be Macs for the back office or iOS devices for the frontline or the care, or patients.
Yeah.
So, Tim, thank you so much for joining us. We really think the model is something that any org could embrace as they look to deploy mobile in their world.
Yeah, sure, man.
Thanks so much.
See you.